and welcome to Clinical Equality Sessions. My name is Sommer Bazuro, and I'm the Chief Medical Officer of the IPG Health Network. We launched the Trial for Clinical Equality in 2020 during a time of much-needed reckoning around racial injustice. Our intent was to raise awareness about the low representation of Black Americans and Hispanic Americans in cancer clinical trials and the implications this has for their health outcomes. But the lack of diversity in clinical trials runs much further and deeper than we could ever have thought, beyond just cancer and a select few minority groups. For example, an evaluation of 9,000 clinical trials from 2000 to 2020 showed that 0% of clinical trial participants are Native American, yet they experience diabetes at the highest rate. Similarly, an evaluation of clinical trials that led to the FDA approval of heart disease medication between 2006 and 2020 showed that 3% of patients in heart disease clinical trials are Black, yet they die of heart disease at the highest rate. This lack of diversity makes clinical trials worth less. It deprives at-risk groups of life-improving or even life-saving medicines. It leads to incomplete scientific data. It worsens the disparities in our healthcare system, costing us billions of dollars, and it degrades trust in the medical establishment. A lot of brilliant minds are doing great work to tackle this complex issue. Today, I have the privilege of speaking to one of them. Dr. Koh, please tell us about yourself.
Good day, everyone. My name is Wui-Jin Koh. I am an academic radiation oncologist by training, having worked at the University of Washington and Fred Hutchinson Cancer Center for many years. But about 6 years ago, I had the privilege of joining the National Comprehensive Cancer Network and serving as its chief medical officer.
Dr. Koh, how much of your work is focused on equity and inclusion in clinical trials?
First, let me tell you a little bit about the National Comprehensive Cancer Network, or NCCN. It is an alliance of 33 leading academic cancer centers across the United States. Our flagship program, which is the NCCN Clinical Practice Guidelines, provide evidence-based, expert consensus recommendations for cancer prevention, screening, treatment, supportive care, and long-term survivorship. We share these guidelines for free worldwide based on the principle that everyone should have access to high-quality cancer care. And studies have actually shown that when patients are treated per guidelines, the amount of disparity or inequity is actually reduced. We also partner with numerous groups, such as the Alliance for Cancer Care Equity, to advocate for laws and policies that will improve equity in cancer treatment and outcomes. This work is focused again across three key focus areas, but advancing diversity in clinical trials is one of the top priorities for these efforts.
Dr. Koh, one of the areas you are specialized in is the treatment of gynecological cancers. Can you list any specific racial disparities within these types of cancers?
Yes, there have been multiple studies that have documented disparities in outcomes based on racial and ethnic differences. These have been noted in ovarian, cervical, and endometrial cancer. We particularly note that the greatest amount of disparity is actually for endometrial cancer, where the mortality rate in Black Americans is twice that of non-Hispanic white Americans. And this is an opportunity for us to do studies that are focused on improving outcomes that not just only address the biology of this disease, but also to help overcome some of the social barriers that may be impediments to Black Americans receiving appropriate care. Black women, Hispanic American women are diagnosed at higher stages and they have a higher mortality rate. Definitely, there's a societal cost that not only affects the patient, but also their families.
How does the lack of diversity in clinical trials impact science and the healthcare system, Dr. Koh?
Clinical trials that do not include diverse populations would not accurately represent real-world population and definitely can lead to biased results. This can lead to treatments that are less effective or even harmful for certain groups of people. Lack of diversity in clinical trials can also perpetuate health disparities. Different racial and ethnic groups have unique genetic, biological, cultural, and social demographic factors that influence their response to treatment. Without adequate representation in clinical trials, these differences may go unnoticed, leading to unequal access to effective treatments and exacerbating health inequities.
So, do you think better representation could make clinical trials worth more? We could get more from that data?
Yes, absolutely. Clinical trials that include more diversity would make the results applicable to a broader swath of the population. This will then allow more persons to benefit and for clinicians and researchers to understand how to address unique differences between persons, between populations, and to tailor therapy even more precisely.
Thank you so much, Dr. Koh, for taking the time to speak with us and share your brilliant insights. Thank you to our viewers. Like and subscribe to watch more of our clinical equality sessions, featuring academics and clinicians working to create change. Together, we can make clinical trials worth more. Join us. Visit clinicalequality.com.